In the morning mix with Jay and Desiree, we've got our own non-political Bill Nye on the line with us.
Great.
Dr. Rodrigue. He's the owner of Rodrigue Eyecare. So Dr. Rodrigue Desiree started in biology before he went to optometry school. Is that right?
That's correct.
So I wanted to ask you, because you have all this background, about hand washing. We see things flying around on social media, the best practices for washing your hands, and Desiree was reading something. If you take a hot bath, you can kill corona.
Or gargle with salt water or vinegar.
What's the science behind properly washing your hands?
Basically, what happens is that you're trying to basically inactivate the virus. And when you wash your hands, the most important thing is to wash your hands and try to make a lot of lather with the soap. Because most viruses, including the coronavirus, have a layer of fat around them, what's called a phospholipid layer. And when you make a lot of foam, what happens is that you basically break down that fatty layer on the virus and you inactivate it. A lot of people think that you wash your hands to try and wash it off. And in a way, you are kind of doing that. But primarily, what you're trying to do is make a lot of foam to dissolve that fatty layer and inactivate the virus. A good hand washing, 20 seconds, make a lot of lather, does the trick.
Take us, if you can, Dr. Rodrigue, under the microscope. What does a virus look like? What is it composed of?
Okay, sure. Viruses, first of all, are non-living matter, which is sort of hard to believe. We tend to think of them as like a bacteria.
Yeah, and you talk about killing the virus.
Right. It's alive. We got to kill it.
Right.
Squirming around out there.
That's right. And basically it's a piece of what a virus is. It's just a piece of genetic material surrounded by protein and then surrounded by a fatty layer. And what happens is that they get into our system, and they attach themselves to our cells. And the virus, basically, especially the COVID-19 virus, looks like it's round. It looks like a burdock, for those of you who are familiar with a burdock.
Yes.
But they're round, and they have these little protrusions on them. Mm-hmm. Basically, they use to attach to the cell. And then what happens is that the cell either engulfs the virus,
like Pac-Man.
The virus kind of gets into the cell, and once that genetic material gets into the cell and gets incorporated into the genetic material of the cell stops doing what it normally does and then starts to produce viruses. So it turns into a little virus factory, you could say, and the viruses just multiply, and then the cell eventually just bursts and releases all of these other viruses to go and attack other cells.
Oh, wow.
And a virus needs a living host. It needs something alive to attach to in order to basically multiply and spread. But the virus itself is not really a living thing. That's why antibiotics don't work when you have a virus or a viral infection, because the virus is not alive. You can't kill it. You can only basically destroy it and break it apart either through hand washing or through your immune system. And once they multiply, then they spread via a cough or a sneeze. And if you happen to be the unlucky person within range of that sneeze, the virus then enters through your nose or your mouth.
Are there limited ways for it to enter into your body?
Like eyes, ears.
And the method, like if you aspirate, right, if you breathe into your lungs, that's obviously probably one of the major ways of contracting it.
Absolutely. To get it into your system, it has to go through your nose, through an opening somewhere, either through your nose
but can you
or through
eat
your
it?
mouth.
I mean, I read some stories saying that don't worry about everything you put in your mouth because it's not an effective way of getting into your system.
Yeah, that's true for most viruses, not all, because basically once the virus ends up in your stomach, most viruses are destroyed by the stomach acids. The pH is so acidic that the virus breaks down. But
So
not
put
all of
anything in
them.
your mouth
Some of
you
them have mutated and developed ways to bypass that.
Oh my God.
But they've been around for a long time. We think they've been around for billions of years. And, not all viruses are bad either. Some viruses are good viruses that help us, and there are some viruses that can attack bacteria and specifically destroy certain types of bacteria. So they're not all bad guys, but
this one is
a bad guy.
What makes it so contagious? What makes it the biggest threat we've seen?
Basically, it's so easy to be infected by these things. They basically are much more infective than, let's say, the flu virus. And what happens is that, fortunately, most people who do become exposed and do catch the virus basically recover quite well. But some patients who are immunocompromised or ill tend to get very, very sick and with this virus, and some people die.
Yeah.
And pretty new and pretty confusing too.
I have a question for you from a listener, Dr. Rodrigue. Sure. It's a virus. Why do we need so much toilet paper? Why the toilet
No one
paper?
else has been able to answer it to this point.
Yeah, we know you've got the answer for this.
There's some science and logic behind
They
it.
probably think it's going to be an intestinal virus. See, they're stocking up,
But this has nothing to do with your intestines. This
Respiratory, right?
It's all respiratory.
All respiratory, yeah. And there, actually, to be honest with you, there have been a couple recent stories that one of the symptoms of the infection with the COVID virus has been some intestinal problems, diarrhea, and so forth. And so that but I don't think that qualifies for a run on hoarding on toilet paper.
Okay.
Dr.
You heard it here first, people.
Dr. Rodrigue, I understand that this COVID-19 is a cousin or closely related to SARS and MERS, right?
That's correct. And some people feel that it could be a mutation from one of those types of viral infections, or those types of viruses. And, of course, with the SARS, the acute respiratory problem, and they behave similarly. And we just think that possibly that they are connected. But the COVID virus is a lot more virulent and devastating to some patients than the SARS virus was.
So not as virulent. However, it could do a lot of damage, but we just didn't hear so much about that back in the early 2000s. And now we're learning a heck of a lot more thanks to people like Dr. Rodrigue and Deborah Birx. And you think they're doing a pretty good job, I would imagine, Dr. Anthony Fauci, right?
Oh, yes, absolutely. I can't imagine the pressure that these guys are under. And especially considering the fact that this is such new territory, I think they're doing a great job. Of course, then you have the political pressure. And
yeah, they get hammered at those press conferences daily, and a lot of those do have those questions that you get from reporters have some kind of gotcha moment. They're trying to get them to answer things that clearly they don't have enough data to answer, and they're really getting put on the spot there. They handle it very well.
Absolutely. It is a very difficult position to be in.
Desiree has a question for you.
Okay, how soon after contracting the virus are symptoms visible? How soon after contracting the virus can you be tested? And how soon after contracting the virus are you contagious? They're quarantining people for 14 days once they get back. But isn't it possible that your symptoms wouldn't even show up until the 14th day? Can't it take that entire time?
Absolutely. Sometimes it does take a couple of weeks or 14 days to show symptoms. The only problem is, even though you're not showing symptoms, you can still spread the thing. And that's why they're saying even though you don't have symptoms, self-quarantine for 14 days. And then after 14 days, if you don't show the symptoms, then chances are you don't have the disease. You haven't caught the virus. Now,
are you contagious immediately? So once you've gotten it, you're contagious.
Yes, exactly, Desiree. After 24, I forget the exact time length, but I think it's within 24 hours of exposure, 24 to 48 hours. Then you start manufacturing the virus in your system, and then you can.
Dr. Rodrigue still with us on the Morning Mix for a few more moments here, and we have got a couple more questions to get to, Desiree.
If you are experiencing symptoms, what should you do?
The first thing you should do is don't panic. Don't panic. If you're experiencing symptoms, first of all, call your primary care physician and let them know. If you have symptoms of coughing and you're not feeling well, isolate yourself, self-quarantine yourself, stay at home so you don't spread it to other individuals. Call your primary care physician. Now, if you develop a high fever or you start having problems breathing, especially breathing, if you're elderly or if you are immunocompromised and you're having difficulty, then go to the emergency room. So if you have symptoms just of coughing and not feeling well, stay home. If you feel that you're developing a fever and you're having difficulty breathing, then go to the emergency room. The emergency room basically is for patients who are very sick with this. You don't want to go there early on unless you really have to, because you don't want to catch it from there.
Of course. All right, Dr. Rodrigue, one more off the text line at 616-1220.
If you have recovered from the virus, you've gone through it, can you get it again?
Great question. The short answer is no, not this season. You've developed an immunity to it, and so you're safe. However, the next season, let's say this fall or next year, you could catch the COVID virus again, because during that time it may mutate and become a little bit different. And if it becomes a little bit different, your immune system won't recognize it and fight it. So the short answer is, for the time being, no, you can't recatch it, but possibly next fall or next year you could, if it does mutate and become a little bit of a different type of virus, a different type of...
If we heard that the vaccine typically takes 18 months, but they're ramping up everything else, they're doing therapeutics and all kinds of other things in record time, FDA is approving some drugs that were already available or thinking about approving it, they're approving these tests and all this stuff, all this good news, is it possible a vaccine is not a year and a half off?
Everyone is working on this. I suspect that a vaccine will be out sooner than that. I would hope, hope and pray that this, that they do come up with a vaccine and start vaccinating for this, because it, who knows, it could mutate and come back, and so we're hoping. I think it won't take that long, to be honest with you, Jay. I think that everybody is on this, and being a pandemic and affecting, individuals worldwide, I think, every country that has the ability to work on this is working on it. Mm-hmm. I know the Germans, the French, and of course the United States and others are working on a vaccination. So I'm sure that they will come out with something, and hopefully it'll be sooner than later.
All right, excellent. And before you go, Dr. Rodrigue, thank you very much for enlightening us using your background in biology to answer these questions.